So, like, how do you like, or what do you even need to know about starting allergenic foods? Okay. So, like we said, we want to start early, as soon as they're able to sit up and swallow safely in those readiness cues we talked about in the beginning, around like 4 to 6 months old. And it doesn't have to be the first food you try, but not the last one either, right? So, like, maybe you've done some squash and some spinach and some sweet potatoes, and now you're like, well, let's give it a little try with peanuts. So, don't put it on the skin, but you can take like a little bit on your tip of your finger, just swipe it inside the cheek, see how that goes. Once you've introduced an allergenic food, you do want to stay consistent. Okay, so this is really important. So you don't want to, like, for example, introduce peanut and wait 6 weeks to do it again. Okay, that could be problematic. What you want to do is, like, every week introduce like a little bit, 1 or 2 times per week. Just be consistent. So, like, you've introduced peanut, so now we do peanut. We do peanut butter once a week. We do it twice a week, whatever. And then you move on to the next food, and you're going to add like sesame or soy or milk, like yogurt, kefir, one of those. Okay. Another fun tip is, if you are doing an allergenic food, try it in the morning, do it sometime that's earlier in the day. And that way it won't be, a time that you're like going to bed, and then you might miss something if there is a little bit of a reaction or allergy that's happening.